And welcome into this edition of ACAP Today for the week of December 6th, 2021. I'm Jason Parent with the Aroostook County Action Program. On this week's broadcast, we're going to speak with individuals who have been responsible for the latest community assessment of needs for Aroostook County. We're going to speak with Jamie Chandler, ACAP's Chief Operating Officer, who also helped direct a statewide community assessment, and a representative of the firm that MeCAP and ACAP worked with, Crescendo. We're going to speak with Caitlin Michaud and Jamie Chandler in just a little bit. But before we get to that interview, as we always do at this point in the broadcast, we're going to first get to the news and information that you can use, again, for the week of December 6th, 2021. And we start with a not surprising news, but news that many of you are very well aware of the rising number of COVID cases, both in Aroostook County and statewide, and encouraging folks, again, that one of the best lines of defense for you and your family so that you don't get sick or extremely sick with COVID is to get vaccinated. The state of Maine is now offering vaccines for anyone age 5 and older, and booster shots are available for anyone who has previously received COVID-19 vaccinations of either of the 3 varieties. If you are in need of assistance in getting an appointment, please do give us a call at 764-3721. If you'd like to go online, you can go to the DHHS website, the maine.gov COVID-19 vaccine site listed on your screen to schedule an appointment or to find an appointment nearest you. We also want to let folks know that there's a free vaccine ride program, so not to let a lack of transportation be a reason for not getting to an appointment. You can call the number on your screen there. We ask that you do that at least 48 hours in advance to arrange for a ride at the time of your appointment. In addition to that, in order to help keep the community safe, ACAP, through a contract with the Maine Department of Health and Human Services, continues to offer the COVID-19 community supports. These community supports can do things like helping with grocery and meal deliveries, helping with shelter and assistance to stay at home or to be away from members of your household if you are impacted by COVID. We encourage you to give us a call if we can be at any assistance for these services. You can call ACAP directly at 764-3721, or you can do a self-referral online at the website listed there on your screen. If you go to the Department of Health and Human Services or just Google community COVID supports, it will take you to the site. You can complete the application. The other good news is you can complete the application for a family member or loved one, whether they live in Aroostook County or another part of the state. All 10 of Maine's community action agencies are participating in this program, so someone from that local area will be dispatched to provide those community supports to your loved one. We also want to let folks know that our last homebuyer education class for the 2021 calendar year is coming right up this Saturday, December 11th, between 8 a.m. and 5 p.m. We encourage you to register for the class if you haven't already and you have interest. There are a number of benefits, including some waiving of closing costs and very impressive interest rates, low interest rates that come as a result for individuals who are financially qualified as a result of taking this homebuyer education class. So we encourage you to contact Don Whipke, who provides these classes to our community. His number 554-4175, or his email address is there on your screen. You can also call ACAP's main line and ask to speak to somebody in the homebuyer education program, and they will connect you. We are also reminding you that the open enrollment period continues here in Maine through January 15th on the coverme.gov website. So if you are currently without health insurance, we certainly encourage you to connect with us. Andrea White is ACAP's navigation assister on the coverme.gov website. She can help you weigh your options and look at different plans on the site and help you with enrollment, even help you to determine through the site if you may be eligible for MaineCare. It's a new site, and we encourage folks who have previously registered and have insurance through the open marketplace to connect with Andrea or to visit the site, because odds are there may be a better plan or a better price plan for you, and you certainly want to do that price comparison shopping. The deadline is coming up really fast, December 15th, for coverage to begin on January 1st. However, as I noted, the open enrollment period does extend until January 15th. Coverage would only obviously be affected after the December 15th date on February 1st. So please plan accordingly, and please use our resource and Andrea in reaching out to get assistance. The Home Energy Assistance Program continues to take new applicants for this year. We have reserved some slots, and there will be more slots as the winter continues for intake interviews. We can do those completely over the phone with you, so you can stay completely safe in your home, and we will work with you to get paperwork mailed to and from our office. We do want to encourage folks who maybe haven't applied in a number of years, or maybe who have never applied before, to look at these income qualification guidelines that we have on our screen here. They're also available on our website. If you or your family or your household, it comes close to meeting these income eligibility guidelines, we encourage you to reach out to us for an appointment. If you have medical expenditures but are slightly above this, we can work with you on some deductions to get you to this figure, if at all possible. In addition to that, we encourage households that have had any change in income who may have applied earlier in the season and may not have qualified. If your household income has changed in the last month or 3 months even, and has been downgraded for whatever reason, please do consider reapplying. Again, the income eligibility guidelines are right there. But even if we denied or your application was denied because you were over income 2 months ago and you've since had a change in employment and have lost income as a household, you may qualify now. So it's worth reapplying in this season, and we encourage that. ACAP has also started a meal train program for our Hope and Prosperity Resource Center. We are offering individuals in that day center a noontime meal. And thanks to one of our employees here at the agency who very casually started this program by providing a meal one day, we've had a number of community members who have joined into this effort and are providing either a hot meal or even sandwiches. We'd certainly accept whatever. And we encourage folks, we typically have between 10 and 15 participants a day in the center, and you can go online on ACAP's Facebook page to sign up for this, or just give us a call at the Hope and Prosperity Resource Center and let us know that you have an interest, and we can help you navigate getting signed up for this program. And lastly, in this week's news and information you can use, if you have any needs, if your family has any needs for any assistance at this time, but just aren't quite sure what opportunities or what programs might be available out there, we encourage you to contact us here. We do have navigators that do this work, and can connect you both with programs within our agency and with programs outside of our agency, including government programs, and help you navigate those. So please give us a call at 764-3721 if we can be of any assistance to you and your family at this very challenging time. And that's this week's news and information you can use. With that, I'm very pleased to formally welcome now to the program, back to the program, I should say, for this first guest, Jamie Chandler, ACAP's Chief Operating Officer. Jamie, nice to have you back.
Thanks, Jason. Happy to be here.
And Caitlin Michaud, who's been doing some fantastic work on behalf of Crescendo, a consulting group that we'll learn a little bit more about in just a little bit here, on the community assessment, not only here in Aroostook County, but statewide. And Caitlin, we're pleased to have you on the program and looking forward to a conversation with you about the great work you've done.
Great. Thank you, Jason. It's nice to be here.
All right, so let's get some context setting to begin with, and I'll do that with you, Jamie, to talk about, first of all, what is a community assessment and why is it so important both to this community action agency and to this community?
Sure. So community needs assessments have been a part of community action agencies since the beginning. And essentially what the purpose of the community needs assessment is for us to look at and assess what are the causes and the conditions that are currently in your community that may contribute to people living in poverty. And for each agency, every 3 years, we are required to conduct a new assessment because, as we know, things change. I think over the last 20 or so months, we've seen that significantly, both here in Aroostook County, but across the state. And so that's the reason, one of the reasons why we do this every 3 years. And we really look at what are the demographics of the people that we serve in our area. We talk directly with low-income individuals. We talk with community partners, and we gather all kinds of information to help us as a community action agency develop goals and strategies that will help address the needs identified in the assessment.
So before we get to Caitlin to talk about sort of the process and then the results, maybe we could set context for folks about why this particular community assessment was so unique and talk about the statewide partnership that developed in the process.
Absolutely. So as I indicated, we do, as community action agencies, have a community needs assessment every 3 years. And One of the unique things that we do here in Maine is that all of our community action agencies work very closely together. And we were having some discussions about each of our unique community needs assessments and how it would be really nice to have a statewide assessment and also to get us all on the same calendar to help share resources and have a united assessment for both us as community action agencies, but for our community partners as a whole. And so essentially what we have done is, and I believe that this is the first time for a community action agency to do a statewide needs assessment with all of the community action agencies across the state. We have worked together to have a statewide assessment. And then there are appendices to the report for each individual community action agency and their coverage area. So this report will not only yield what the statewide needs that were identified were, but also what the individual needs for each community action agency across the state and their coverage area are.
Now, I know that, Jamie, you also had the pleasure of sort of leading the statewide group in addition to leading ACAP's work in partnership with Crescendo. Just briefly, before we get to Caitlin to tell us a little bit about Crescendo, we've been talking about that and dropping the name here. That effort, talk about how that effort went working collaboratively with the state. You just acknowledged it was the first time, certainly something that's worth repeating.
Absolutely. I really feel like the results of this are going to be utilized not only in the community action world, but across many sectors of Maine. I know there are a lot of organizations and stakeholders who are interested in seeing the results of this assessment. And not only here in the state of Maine, but also there are some partners from across the country, community action agencies and state organizations who are watching this assessment because they certainly see a benefit in replicating this in their states as well.
That's wonderful. All right. And this is sort of where you enter into the picture, Caitlin, and Crescendo. I know that Jamie and her team of the statewide leaders of community action agencies through Maine started with a process in which we knew we needed assistance to do this work. It's not something that community action agencies do on a daily basis in terms of surveying and connecting with the community in that way. We do the actual rubber hits the road work, if you will. But we put out a request for proposals. Jamie and her team put out a request for proposals. Crescendo responded to that and was the selected firm. So maybe talk a little bit about who Crescendo is and how you came upon doing this work, and then maybe we'll start to talk about the process in which you undertook.
Great. So Crescendo is about 18 years old or so. We are a Maine-based company. We're based now in Westbrook. We're downtown Portland for many, many years, but since shifted out of Portland into Westbrook now. So it's a real honor to be able to work in our home community. Our team is primarily made up of Mainers. I'm born and raised in the Portland area. I currently live in Bangor. Our managing principal is from Standish. Another one's from Scarborough. So we are a Maine-based company with Maine employees. So it was an honor to be able to work in our neighbors and our communities to really work on this important project. And it's a really critical time to be doing this work. Crescendo does specialize in doing needs assessments across the country. So for many decades now, we've been working with community action agencies. We've worked with a lot of hospitals, health systems, municipality, really focusing on kind of social determinants of health, housing research, and just doing needs assessments. You know, it's something I personally love doing. I'm a researcher at heart. That's my background. So I really love digging into the data to really get a sense of what people struggle with most in the communities. And that's a great opportunity. And what the needs assessment is really all about is not only looking at a lot of, data tables and being a data nerd. I am a data nerd myself, so I enjoy looking at numbers, but we also get to talk to real people and really get the stories right out of the horse's mouth, if you will, of people that are struggling day to day for a variety of reasons. So you really get to understand kind of the root causes where people struggle. And then we're able to write a big report and then hand it off to yourselves, ACAP, or other community action agencies or other organizations that really take that report to heart and actually do the important work in the community. And it's great to see, the work that happens in the community as it rolls out and see the improvement and the impact it has on people's lives.
So to that effect, talk about the process that Crescendo undertook in partnership with Maine Community Action Partnership and ACAP here locally in Aroostook County to undertake this massive, because it's quite a massive undertaking when you look at the multiple secondary data sources that you look at and the work that you actually do engage the community in, as you just alluded to get many voices at the table, and certainly in this case, not necessarily at a physical table in many cases because of the pandemic. So that sort of added a wrinkle to it. But so talk about the process.
Yeah, so this is one of our largest projects we've done with multiple stakeholders. Typically, we work with one organization, and maybe that one organization has a couple locations, but working with 10 organizations plus MeCAP as kind of the umbrella parent organization here, so really 11. And then, of course, within each organization, everyone has their other stakeholders. So all of a sudden, your network gets wider and wider, and a lot of people are involved, which is really good. But sometimes with that many people, we all have that saying, too many cooks in the kitchen. We all celebrated Thanksgiving recently. Some of us might have got kicked out of the kitchen. So it's typically me. Can't pluck off.
I think I kicked my wife out is actually what happened in my house.
But yes, it's a big process with multiple stakeholders. And we take a kind of two-prong approach to our research where we do the quantitative data, really dig into a lot of the secondary data. Some of the challenges with a lot of the secondary data, because we pull a lot of data that's publicly available through the US Census Bureau or from the state websites, a lot of health data out there, a lot of other sources that we use from, but it's outdated. The most recent data we can get right now is 2019. That's before pandemic. So we all know life has changed over the past 18, 20 months now. So, and 2020 data has been a little slow to roll out due to ongoing COVID right now. US Census Bureau is a little behind crunching their data numbers. So we have 2019 data. So yes, it's great to have that data, but at the same time, it is a little outdated. So we don't know how much has changed, especially around poverty or population. We do know there are changes happening, some really good things happening here in Maine, like our diversity is increasing, but we also know poverty has likely increased as well. So we look at a lot of data, again, within the large report when it becomes publicly available in the next few weeks to a month or so, you will see a lot of data tables. So for the data nerds out there, you can get excited to look at that. But certainly the real meat of the project, and my favorite part of it, is the qualitative research. And that's where we spend time talking with people. We completed over about 150 stakeholder interviews across the state, mostly with community leaders, elected official, board members of the community action agencies, elected officials from, the state, a lot of community organization, and just general clients and community members. Anyone who wanted to talk to us, we were more than happy to talk with them one-on-one. We also completed over 25 focus groups across the state. As we talked a little bit about with the pandemic, some were virtual, some were in person. We did what most people were comfortable with, just knowing the health, and it was important to everyone as well. So again, we talked to another 250 people or so, plus or minus a few there we might have missed on our sign-in sheets. And then we did a large-scale survey as well with over 7,000 people across the state. So we have a good, robust number of people that participated in this project, or at least they are all given the opportunity to participate in this project. And that's the most important part of the needs assessment, is making sure people have the opportunity. We want to hear everyone's voices if they want to speak to us. So we do try to outreach to especially some of our vulnerable populations here across the state, some of those that are typically marginalized as well. We want to make sure their voices are heard in one way or another. Within Aroostook County, we did 13 stakeholder interviews. We held 3 focus groups, all in person here for ACAP. With about 10 or so participants across each of those. And then we had a really robust community survey responses as well, with almost 900 responses in the community survey. So it gave us a really good data number to really get a sense of, what's happening within Aroostook County, and not just the state as well, because it's important that, there's a lot of trends across the state that we see in the varied or 16 counties. There's a lot of similarities, but there are differences as well in each of the counties. So it's important to understand the differences, because that makes each kind of geography a little different than the others, and some of the challenges that community action agency might have.
And Caitlin, to that point, and Jamie, I'm going to sort of draw this question to you, because we really did the same here in Aroostook County, because as much as Caitlin is completely correct in terms of variances across county lines, here in Aroostook County, a large piece of geography, we have variances from community to community and certainly sub-region to sub-region. So I know that in your work with Caitlin, we looked at, and you talk about here the 3 focus groups that were held in Aroostook County. Those were held geographically in geographically diverse areas. The stakeholder interviews that were held, the community survey responses, we really had a lot of intentionality around ensuring that voices from different pockets of Aroostook County were in this data.
Absolutely. I think that that was probably one of the most important things for us as a community action agency is we wanted to ensure that we know that transportation is sometimes a barrier for folks. And so being able to offer opportunities for those focus groups to happen in regional areas. So we had a southern region, a central region, and a northern region stakeholder, focus group opportunity. And then we had stakeholders that either had worked with organizations that had county reach or tried to specifically ensure that we had representatives from all of the regions of Aroostook County. And I feel like those who were able to participate in those opportunities certainly are a good selection of people from all across the county.
Now, Caitlin, I know that there's still some work that's being done, and we're going to be respectful of the statewide effort and some of our sister CAPs who haven't had their board presentation, but you were with us leading into the Thanksgiving holiday in our board meeting in November to sort of share the overview of results, both some statewide data and some Aroostook County data. And we're also making Jamie available to speak with community groups and to present this data as we head into the new year once it's been publicly released to everyone across the state, and all CAP agencies are at a point where they've had the presentations to their board. But you are going to share with us a little bit of sort of the overview of some of the top needs both in Maine and Aroostook County to give people a little flavor for what the results are looking at, and maybe provide us with a little bit of context for how things led to developing these particular priority areas, or how the data sort of spoke to this. So let's start with the statewide top needs. There were 6 that are identified and laid out. So maybe let me bring that screen up, and maybe you can talk about a little bit the process for how that refinement of getting to these top 6 happened, and then maybe speak a little bit to these.
Yeah, so the needs prioritization process is always a very difficult one for all organizations who do this work, not just community action agencies, but any social service or healthcare or service-based organization. As a service-based organization, you have that kind of in your heart where you want to help as many people and all people as possible. But social service agencies, especially those that are largely funded by grants, are also very limited by funding, by resources, capacity, regulation. So it does make it difficult to, provide help to everyone that we want to help that needs it. So we really have to kind of prioritize what the needs are and really what we can focus our next 3 to 5 years on to have the greatest impact on our community, or really help the most people, or the number of people with the most challenges or barriers they might experience. So we take we use an old Delphi method. So if anyone likes statistics or numbers, it comes from the RAND Corporation, and we've modified it for our crescendo kind of methodology when it comes to needs prioritization, where we work with the leadership group, Jamie and her other cohorts across the state with the other 9 community action agencies. So we did a survey to start with of, I think, based on the research, we had a total of about 35 needs. So 35 is a lot in that, and for any community action agencies, you're not going to address everyone. And some of those needs that we identified just don't fall in the work or the mission that a community action agency does, but there's very much a community partner or someone else in the community that's really what their mission is. So it's good to work with that organization, either in a partnership or just a supporting or advocacy role. So there is a role that community action agencies can use for each of the needs, but knowing that they can't do everything as much as we all want to. So with the 35 needs, that helped us kind of, again, think about how to prioritize them. It helped us at least get our first initial rank order of the 35 needs, kind of 1 through 35. And then we had 2 90-minute discussions with the leadership group, to really talk about our needs and really, again, identify what we as community action agencies can do to really, again, impact the community. What do we have resources for? What do we have current services for, our current staff capabilities of doing? And that's how we got down to these 6 needs that we identified. We kind of put a few of them into umbrella buckets here. Each of these kind of have some more granular items that go under it. So you'll see that in the report eventually. But our top issues, to probably no one's surprise, or to a lot of people's surprise right now, affordable housing. This has been an ongoing challenge for even before the pandemic. And most of these needs that we have identified really are issues that were challenges before the pandemic, but due to the pandemic and kind of the environment that it created, that the magnitude of need has increased significantly, especially for a lot of people, or maybe new people for the first time due to workforce changes or COVID restrictions, are now experiencing some of these needs. So affordable housing is a challenge across the state. We're especially feeling pressures in the southern part, the coastal part as well. So affordable housing, especially around the rental market for people that need to rent, that affordable renting units are just not available. And there is a lot of work being done at the state now on how to help improve this challenge. Affordable quality childcare. This is a really complex challenge because you have to look at it from, as a consumer, if you have a child and need childcare, the COVID-19 impact of that is a lot of childcare providers have either stopped providing it, they just went out of business, or they've had to reduce their capacity significantly, or they can't find staff. So all of a sudden, maybe you had a childcare spot, you took your childcare out due to COVID, and now you're trying to get it back, but that spot no longer exists, or someone else is using it. So it's very challenging. And again, from the employer side of childcare, it's hard to find staff right now because there's certain qualifications that childcare providers, especially in Head Starts or other kind of preschool or educational environments, need to have. So it's challenging as a provider to make sure that you can have the staffing so that you can have maximum capacity. And just the affordability of childcare can be very, very expensive, especially if you have multiple children. Ending the cycle of generational poverty. And this is kind of really an overarching need within the community. And we especially see this in our more rural areas of Maine, where largely a lot of the traditional industries here in the state of Maine, such as the paper industries or some of the wood manufacturing, or a lot of our agricultural and fishing industries and other kind of traditional Maine businesses and industries that have been here for decades or centuries, the times have changed. Everything has gone to digital and technology now. We do have an older workforce. Maine is the oldest state in the country. So some of our workforce is older. They don't have those technical skills that some of the younger generation will have. And that's where a lot of our jobs are going to. So this also creates some of that generational poverty. And sometimes it's hard to get out of that cycle. So we have to figure out how we can empower people to break the cycle of poverty. It's also intertwined with a lot of other challenges as well. Substance use can be involved with this, mental health, again, lack of living wages, transportation. So it's a very complex challenge as well of breaking that cycle.
And those are what's appearing in slots 4, 5, and 6, that holistic person-centered approach, transportation. And then number 6, which I think we've all found, obviously has a connection right back to number 1, but has become quite pervasive and challenging through this pandemic, if certainly was before, but has been sort of really put under a microscope in the last 20 or so months.
Yeah, for sure. And I know the state and other organizations within communities across Maine are working on a lot of these challenges now. So I know they recently redid the whole homeless system, kind of how people enter the system as well. So I think there are going to be some hopefully positive changes coming, but it's not something you snap your finger and it happens overnight either.
Now, when we look, Caitlin, at Aroostook County in terms of the prioritized needs in Aroostook County, we see a lot of similarities on that list, and there's a top 5 on this list. And let me get that up on the screen so you can speak to these as well.
Yeah, so again, every county, every community in Maine is different. And there's a lot of similarities, but there's a lot of differences. So that was one of the challenges doing a statewide needs assessment that we had to overcome, is that, yes, we can prioritize needs for the state of Maine, but again, knowing everyone's a little different. Aroostook County is very different than down east, or it's very different than the greater Portland area. So we needed to address that. And that's why every community action agency did their own prioritization to work on the needs that's most important to their community, or that is having the greatest impact on their community and their population. So as a result of kind of going through a similar process at the state level for each of the community action agencies, we have the result of these top 5 needs for ACAP here. Again, childcare is a big one, and it's a very big barrier for a lot of people with employment. So it's often tied to number 4 here, where a lot of people can't work right now because, again, they can't find a childcare provider, and you can't leave a 5-year-old by themselves. So again, a lot of challenges, and it goes both ways too, because again, you can get a job, but is it enough to pay for childcare? So again, very complex, and all these needs at the end of the day are just intertwined and connected. So it's hard to separate one out and, work on that one. You have to work on all of them. We have that saying that, the tide raises all boats, and that's kind of what we're working towards here. Can't raise one boat higher than the other. It's not how the ocean works. So
even though we're miles away from the coast.
Exactly.
That applies in Aroostook County too.
It does. Yeah, you have a lot of beautiful lakes. Not sure they have tides, but
they'll drop if we have a drought.
There we go. Yep. So housing, again, affordable housing, or just the supply of housing too. It's not always just affordability. It's just the sheer supplies. Do we have the availability of houses to either sell or rent right now? And also making sure they're safe and in quality. As we talked about earlier, Jason, you presented kind of about your heat program and the heating assistance. Rising costs of utilities and heat right now is becoming very critical. We have inflation happening, the oil is rising. So thinking about utility and heat assistance, especially over this winter, that it could be a very cold winter and we could use more oil than maybe we did previous years. Healthcare is always a challenge too, especially mental health, substance use as well. There's a great, if anyone has Hulu, there's a great show on called Dope Sick right now. And it's kind of based on the true story of how the opiate epidemic was started, where Purdue, which is a drug maker of many of those opiates, targeted rural Maine. So they targeted down east, they targeted Aroostook County, and it kind of plays into how the opiate crisis, and since a lot of our other substance use issues here in the state has started. And it's a very challenge, and it's certainly some preliminary data is showing due to the COVID as well, that those numbers have risen. I believe recently we passed the number of drug overdoses in the state of Maine over last year's total already. They released, CDC released national data that we've had over 100,000 overdose deaths in the country as well, which is the first time we've ever hit that kind of benchmark. Hopefully it's not a good benchmark, but these are the challenges we're having. And a lot of this is the impact of the pandemic and social isolation and just coping skills. It's very hard to cope when you're alone in your house in the middle of winter in Maine and in Aroostook County with nowhere to go. So, a lot of challenges when it comes to access to mental health and substance use services and providers. Aroostook County is very rural, very spread out geography, large community. So sometimes to get to even your primary care doctor, it could be a 30-minute, it could be an hour drive, especially in the winter when the roads aren't great. So there's a lot of challenges that are healthcare as well, employment as well. We all know that every business out there has help wanted signs out there, but it's both an employer side, but also an employee side too. Because again, there's a lot of employees who want to work, but they can't because they don't have transportation. They don't have childcare. So it's limiting their abilities to get a job. But from the employer perspective too, a lot of these jobs aren't necessarily a living wage. So yes, you can get an entry-level job, but I can't afford my family of 4. We can't feed, house, have a car, have childcare, have health insurance on that wage. So it's kind of a complex need that is hard to address. But I think we are making in the state of Maine and locally, we're making headway towards that. And transportation as well. I always kind of joke with people when we talk about this, because again, Crescendo does this work across the country, and transportation, no matter who the client is, no matter where they are, they could be in the middle of New York City, or they could be the middle of a cornfield in Iowa. Transportation is always going to be the top challenge. And it's a really hard one to fix. And I always tell people, I'm like, if you can solve the transportation problem in the United States, you will get the Nobel Peace Prize, because it's that level of challenge. And unfortunately, a lot of the fixes for transportation is money, and we just don't have enough money to work on a lot of these transportations. So
And we much prefer the reference in the middle of a potato field in Aroostook County.
Okay,
Yes. In Iowa, Caitlin. But certainly, so those are, I don't think came as any surprise to us. And I think I'm glad that in your description, you indicated in sort of the more broad healthcare category, and really it has connections to employment and other provisions, that something that showed up very prominent in our last assessment, which includes the opioid epidemic and behavioral health, are in fact there as well, just embedded in the larger overarching healthcare category.
Yeah. Yeah. And our system is our healthcare system is very siloed, and, we very much treat people as body parts. We don't treat people as whole people. And I think that's where, this is again, kind of policy, kind of philosophy version of healthcare, but that's where we need to go, is treating a person as a whole person. And that includes the mental health and their physical health. And you can't really separate, the two out.
Absolutely. All right. So Jamie, we know that what happens in the sort of more immediate future is sort of rolling this information out to the greater community, including the opportunity for you to present at various groups with the results of this, and sort of get this out publicly and link it to our website and the like, which again, we'll wait until we've done a statewide rollout on this and that all of our CAP agencies are at the same place. But from your perspective, it doesn't really stop there. And from this CAP agency's perspective, this is really just the beginning of a process. Talk about what happens next.
Sure. So so this is really the starting line for the work that ACAP is going to do with this report. So we will be launching a strategic planning committee here within the agency to look at these needs, to really dig down into the data and look at some root causes, and to identify some strategies that we as an agency will either do in partnering with other community partners, because as Caitlin said, community action agencies can't do this alone. This is certainly it's a community needs assessment. It's not ACAP's needs assessment. And so we will be working with our strategic planning group. We will be working as we do presentations with other organizations to help identify the strategies that new and updated strategies that we will be needing to or wanting to implement to help us to address these needs.
We will have you and the other members, or some other members, your leadership of the strategic planning committee, which does include both ACAP staff and board members, on a future edition, probably more than one. We'll probably talk about the process early on, and then certainly come back with the results of our strategic plan in a program similar to this, to talk about how we'll move forward with beginning to implement what will be a brand new strategic plan after our board has approved it. So looking forward to that future conversation, but I just want to provide the opportunity, Caitlin and Jamie, for you to talk any more that we haven't talked about, or anything that we've missed that you wanted to ensure folks knew about this process, about the results, although we're not fully talking about them at this point, but will be shortly. What did you want folks to know that we haven't covered so far? Caitlin, let me begin with you on that question.
Yeah, I think, again, we're in a critical point in the world today where we are still very much in a global pandemic. COVID's not going away. There's a potential new variant coming out. So as much as we all want to pretend to go back to our real life and real world again, we're still very much in a critical period where things change very fast. And, people that have never struggled with before are struggling now, whether it's financially or just emotionally or mentally. And I think it's important to, make sure people are aware of resources available in their communities, and community action agencies do amazing work in communities, and you provide so much services and programming out there, and you're also serving as kind of an entry point for a lot of people for various programs in that referral process. So I think it's important to spread the word about ACAP, spread the word about the other community action agencies in Maine and even across the country for those that have family or friends in other parts of the country. So if someone's struggling with paying their rent or affording their medication or childcare or whatever it might be, to reach out to your local community action agency and ask for help. Don't be afraid to ask for help. I think that was one of the biggest takeaways that from doing this research, doing this research across the country, we don't hear in other places, but Mainers have a hard time asking for help. We're very prideful people. We're very much pull ourselves up from the bootstraps. That's kind of how we're raised, but it's okay to ask for help. So I think, talking with your friends and families and just letting them know it's okay to ask for help if you need it.
Absolutely. We certainly want to underscore that point, and I think we have with our community, and please do reach out for help. One of the other things that I just quickly want to note with you that was really interesting, Caitlin, is that you happen to present these findings and the work of the Community Needs Assessment report to our board of directors at our annual meeting. And it was directly following the opportunity for us as leadership of the organization to present to our board of directors the work that we've done over the last year. And you even commented on the alignment between the needs in the community and the work that was happening here at ACAP. And so I thought that was great to have you sort of both see that in a full circle kind of way, but also to be able to acknowledge that there's a direct correlation between the work that you've done and the work that we do every day. And to that point, Jamie Chandler, your thoughts on this process, as this particular chapter of the process, as you pointed out, it's going to continue. It's just really the beginning of the work. As this particular first chapter of the work is sort of wrapping up now, what are your thoughts, and what did you want to make sure people knew?
I just want to first and foremost thank everyone that either completed a survey, that participated in a stakeholder interview, or came to one of our focus groups. Without your information, without your as Caitlin said, the qualitative piece, it's the story behind the data. And without that, our community needs assessment would be pretty bare looking. And so for that, I want to thank all of the community members, both here in Aroostook and across the state, that helped us in putting this together. This truly is a comprehensive assessment and really focuses on the needs of individuals in our community. And I'm really looking forward to when we can launch the report, because there are some really unique data tables that really break down the data into very interesting from a different perspective and different viewpoints. And so I think many community members, many of our community partners will be looking forward to being able to take a look at that. And see how it applies to the work that they themselves do as well. And I guess that too is a message that this report, please utilize it. We put this report out to help guide our work and guide our strategy, but certainly we encourage any community member, any community partner to use this in their work as well. That's the purpose of these types of community needs assessments.
It will certainly be a much better product for our entire community if folks do use this, and we encourage it. This is not something that we take any proprietary. We commissioned this to be done, but the results are truly and the needs are truly that of our community. So we encourage all folks to get on board, to utilize it, and to also join us. And I guess to that, Jamie, I would add one other set of thanks, and that's to the individuals on the front lines every day, our ACAP team members, our partner organizations who are working to combat the challenges around these needs and to celebrate the victories when we have successes around making life better collectively in Aroostook County, as well as the countless number of volunteers, including our own board of directors and others who work on this day in, day out to make a difference and meet needs of people across Aroostook County. Caitlin Michel, thank you so much for joining us, for giving us a little bit extra of your time, Crescendo's time, to come in this public forum to help us get the word out about the great work that you've done in partnership with Maine Community Action Partnership and ACAP here in Aroostook County. Jamie, we'll see you shortly on another edition as we continue this conversation and the iteration that it takes on next as we prepare a strategic plan from this and we prepare to share this information with a wider community. Thank you both so much for being my guests. And before we leave you, we want to say thank you to you for watching and for tuning into this program, but also share with you these last bits of information. One, that if you are hearing about these community needs and would like to be part of the team that helps to work on solving them each and every day in Aroostook County, we do have openings on our ACAP team across Aroostook County, and we would love to see your application. If you have the background and information from our website and you feel that you match, your qualifications match what we're looking for, and you have the passion and drive to do this work every day, we encourage you to apply for a position. You can do that through our website. We are currently offering a $500 sign-on bonus and some pretty okay benefits that you can see there on your screen. And we encourage you to look into those further as well. And lastly, as we do at each point in the broadcast before we leave you with our inspiration, our snapshot of the week. And this is one of the children in our early care and education program at the Presque Isle Regional Career and Technology Center, where we have a classroom embedded there to work with the high school career and technical education students who are looking to go into childcare as a career. This young child is looking truly at safety first. This photo was taken shortly after Fire Prevention Month, which is in October, and we're very blessed to have firefighters from across the area visit our programs and work with the children, take the fire truck out and show the children the importance of fire safety. So he is truly following in the footsteps of some giants and some heroes that we have here in the community who showed him what being a good firefighter is all about. So we're glad to see him understanding the career and the importance of having our own heroes here in the community. So our hats off to not only the children in this program and the students they work with at the high school level and our teachers, but also to our area firefighters across Aroostook County who donate their time to go in and help educate not only children in our programs, but in school programs across Aroostook County. Our fire hats off to you. Thank you so much. And with that, that's this week's edition of ACAP Today. We'll be back next week with a brand new edition, and we hope to see you then. Have a great week, everyone.